Hello everyone, this is Anan Khan. I've completed my BMS and recently I'm working as an intern in a hospital. So friends, in my previous lessons we have discussed about the anatomy, physiology as well as the pathology, but that pathology was part 1 and today I am with the pathology of digestive system, which is the part 2. Today I will discuss about the various and the commonest diseases seen. So, first one is the diarrhea. You must all be aware of it. Diarrhea is the frequent and profuse discharge of intestinal content in loose and fluid form. Okay, it occurs due to increased movement of intestine. This diarrhea can be of two types, can be acute or can be chronic. The general cause of this diarrhea can be dietary abuse, that is the intake of contaminated food, reaction to certain medications such as the antibiotics or laxatives, or infections by bacteria, virus and parasites. The symptoms of the diarrhea is dehydration, that is the loss of excess water and electrolyte, which further causes water electrolyte imbalance in a person. Then nausea, vomiting and bloating, that is the abdominal is full and tight due to accumulation of intestinal gas. That's for diarrhea. Now moving forward to the next very common disease, that is the constipation. Constipation is nothing but the failure of voiding of the fecus, okay, which produces discomfort. Why? Because due to lack of movement necessary for defecation. Due to absence of mass movement in the colon, the fecus remain in the large intestine itself for a long time, hence resulting in the absorption, so the fecus become dry and hard and sometimes it comes out with pain. The causes of constipation, the first one is similar to that of diarrhea, that is the dietary cause, but here the lack of liquid in the diet causes the constipation, which makes the stool tight. The second is the irregular bowel habit, and the third one is the drugs such as the diuretics or any pain relievers, anti-hypertensive drug, antidepressant drugs or anti-Parkinson drugs. So, in that sequence, the next disorder and the very common one is the vomiting. The vomiting is also known as emesis. It is the abnormal emptying of the stomach and upper part of the intestine through esophagus and mouth. The causes of vomiting can be presence of some irritating contents in the GI tract, or in case of pregnancy, that is a physiological condition that subsides. The next can be nauseating sight or odor or taste, excess alcohol intake, any GI disorder, drugs such as antibiotics, or any acute infection such as UTI, that is the urinary tract infection, influenza, etc. And in the same sequence, the very common disorder which comes next is the hepatitis. Hepar means friends liver and itis indicates inflammation. So altogether hepatitis means inflammation of the liver. It is the liver damage which is caused by many agents and characterized by swelling and inadequate functioning of the liver. The hepatitis is of two types. First is the viral hepatitis and the second one is the bacterial hepatitis. So what is viral hepatitis? It is mainly caused by two viruses that are hepatitis A and hepatitis B. The cause for this can be intake of any contaminated food and water of this virus. Second can be sharing needles with the infected person, the person who is already infected with viral hepatitis. Third can be blood transfusion procedure, or fourth can be unprotected sex with the infected person. The symptoms for viral hepatitis are fever, nausea, vomiting, headache, weakness, loss of appetite and diarrhea. One thing you must keep in mind, friends, that the hepatitis B virus are more dangerous as compared to hepatitis A, because this virus can lead to cancer of liver as well as cirrhosis of liver. So now the next comes is the pancreatitis. Again, pancreas and itis, that is the inflammation of the pancreas. It is of two types, acute pancreatitis and chronic pancreatitis. Acute pancreatitis is more severe and it occurs because of the heavy alcohol intake or gallstones. The symptoms of acute pancreatitis is severe upper abdominal pain, nausea and vomiting, loss of appetite and weight, fever and shock. Whereas chronic pancreatitis develop due to repeated acute inflammation or chronic damage to the pancreas. The causes for chronic pancreatitis can be hereditary, prolonged alcohol consumption, congenital abnormality of pancreatic duct. The symptoms are fever, nausea, vomiting, tender and swollen abdomen, and weight loss. That's all for the pathology part 2. Hope you all understood and it will help you. Thank you.